Assalamualaikum. Good morning, everyone. How are you?
I'm good, nurse.
Okay, Alhamdulillah. We are from Brawijaya University Nurse Department. We will conduct promotion of health about diabetes mellitus. Before we explain, let us introduce ourselves. I'm Anis as a moderator. We will lead the way of this event, and next to me is the nurse Nabila Zindi, who present the material of the second, is nurse Warda, who present the material of today health education too. We will give you the health education about 20 minutes. Well, before I open this event, we should read Basmalah first. Bismillahirrahmanirrahim.
Bismillahirrahmanirrahim.
Okay, let Nurse Nabila and Nurse Wada to present the material of health education today.
Well, before I explain the understanding of diabetes mellitus, the cause, site and symptom, risk factor, the complication and prevention of DM. Do you know what is diabetes mellitus?
I can answer, nurse. I think diabetes mellitus is a high blood sugar.
Well, thank you for the answer.
And now what are the causes of DM?
I can answer nurse the causes of DM. The immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas.
Very good answer. Thank you.
You're welcome, nurse.
Now, I will explain the DM in the health file, starting from understanding the DM. Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes from the food you eat. Insulin, a hormone made by the pancreas, help glucose from food. Uh, any insulin are thus use insulin well. Glucose then stay in your blood and thus reach your cell. Next, that few different type of diabetes. Next type of diabetes. There are a few different types of diabetes. Type 1 diabetes is an autoimmune disease. The immune system attacks and destroys cells in the pancreas where insulin is made. It's unclear what causes this attack. About 10% of people with diabetes have this type. Type 2 diabetes occurs when your body becomes resistant to insulin and sugar build up in your blood. Pre-diabetes occurs when your blood sugar is higher than normal, but it's not high enough for, for a diagnosis of type 2 diabetes. Gestational diabetes is high blood sugar during pregnancy. Insulin blocking hormone produced by the placenta cause this type of diabetes. Next. Symptom of diabetes. General symptom. The general symptom of diabetes include 1. Increased hunger, 2. Increased thirst, 3. Weight loss, 4. Frequent urination, 5. Blurry vision, 6. Extreme fatigue, 7. Short that downhill. Next. Next is the cause of diabetes. Different causes are associated with each type of diabetes. Type 1 diabetes and type 2 diabetes. Type 1 diabetes, doctor don't know exactly what causes type 1 diabetes. For some reason, the immune system mistakenly attack and destroy insulin producing beta cell in the pancreas. Genes might play a role in some people. It's also possible that a virus set of the immune system attack. Type 2 diabetes system from a combination of genetic and lifestyle factor. Being overweight or obese increase your risk to carrying extra weight, especially in your belly, makes your cell more resistant to the effect of insulin on your blood sugar. This condition run in family. Family members share genes that make them more likely to get type 2 diabetes and to be overweight.
Okay, thanks for Nurse Nabila Cindy. Next will be explained again by Nurse Wardah.
Okay, thanks the moderator. I will explain about risk factors, complication, and prevention of DM. And the first diabetes risk factors, uh, type 1 diabetes is you are more likely to get type 1 diabetes if you're a child or teenager. You have a parent or sibling with the condition, or you carry certain genes that are linked to the disease. And the type 2 diabetes, your risk for type 2 diabetes increase if you first are overweight, next are age 45 or older, and the next have a parent of sibling with the condition. Next, aren't physically active, have had gestational diabetes, have prediabetes, have high blood pressure, high cholesterol or high triglyceride. Next, next, the about complication of diabetes. Complication is a heart disease, heart attack and stroke, neuropathy, nephropathy, retinopathy, and vision loss, hearing loss, foot damage such as infection and sores that don't heal, and skin conditions such as bacterial and fungal infections, via depression or dementia. Treatment of diabetes, type 1 diabetes is insulin is the main treatment for type 1 diabetes. It replaces the hormone your body isn't able to produce. There are four types of insulin that are most commonly used. There are differences by how quickly they start to work and how long their effects last. The first rapid acting insulin starts to work with 15 minutes and its effect lasts for 3 to 4 hours. Short acting insulin starts to work with 30 minutes and lasts 6 to 8 hours. Intermediate acting insulin starts to work with 1 to 2 hours and lasts 20 to 80 hours. Long-acting insulin starts to work a few hours after injection and lasts 24 hours or longer. Next. And then treatment of diabetes type 2. Diet and exercise can help some people manage type 2 diabetes. In lifestyle, changes are enough to lower your blood sugar. You will need to take medication. These drugs lower your blood sugar in a variety of ways. The type of drug is the first alpha glucosidase inhibitors. How they work? Uh, Alpha disease slow your body's breakdown of sugar and starchy foods. For example, acarbose, fructose, and methylglycides. Number two, biguanide, and then they work reduce the amount or glucose your liver makes. For example, metformin, glucopage. Three, DPP for inhibitors. They work improve your blood sugar without making it drop too low. And for example, linagliptin, saragliptin, and sitagliptin. The four, glucagon-like peptides. They work change the way your body produces insulin. For example, gulaglutide, exenatide, and liraglutide. And the next be megatinides. How they work? They work stimulate your pancreas to release more insulin. And for example, natagilinide and repaglinide. The next be SGLT2 inhibitors. How they work release more glucose into the urine. For example, canagliflozin and dapagliflozin. Next be sulfonylureas. They work stimulate your pancreas to release more insulin. For example, medication is gluburate, glipsit, and gimapiride. And the last be thiazoidinedions. They work how to help insulin work better. For example, be pioglitazone and rosiglitazone. Next, how about prevention diabetes? Prevention about diabetes type 1 isn't preventable because it's caused by a problem with the immune system. Some causes of type 2 diabetes, such as your genes or age, aren't under your control either. Yet many other diabetes risk factors are controllable. Most diabetes prevention strategy involve making simple adjustment to your diet and fitness routine. If you've been diagnosed with prediabetes, here are a few things you can do to delay or prevent type 2 diabetes is get at least 150 minutes per week of aerobic exercise, such as walking or cycling. And the next, cut saturated and trans fats along with refined carbohydrates out of your diet. And the next, eat more fruits, vegetables, and whole grains. Eat smaller portions and try to lose 7% trusted search of your body weight if you're overweight or obese. Next, diabetes and diet. Type 1 diabetes, your blood sugar level rise or falls based on the types of foods you eat. Starchy or sugary foods make blood sugar levels rise rapidly. Protein and fat cause more a gradual increase. Your medical team may recommend that you limit the amount of carbohydrates you eat each day. You will also need to balance your carb intake with your insulin doses. Work with diet who can help you design a diabetes meal plan. Getting the right balance of protein, fat, and carbs can help you control your blood sugar. Next, and then the type 2 diabetes, eating the right types of foods can both your control your blood sugar and help you lose any excess weight. Carb counting is an important part of eating for type 2 diabetes. A diet can help you figure out how many grams or carbohydrate to eat at each meal in order to keep your blood sugar levels steady. try to eat small meals throughout the day. Emphasize healthy foods such as fruit, vegetables, whole grains, lean protein such as poultry and fish, and healthy fats such as olive oil and nuts. Diabetes diagnosis. Anyone who has some types of diabetes or is at risk for the disease should be tested. Women are routinely tested for gestational diabetes during their second or third trimester of pregnancy. There two doctors use this blood test to diagnose prediabetes and diabetes. The fasting plasma glucosa test measures your blood sugar after your fast for 8 hours. The A1C test provides a snapshot of your blood sugar levels over the previous 3 months. To diagnose gestational diabetes, your doctor will test your blood sugar level between the 24 and 28 weeks of your pregnancy. During the glucose challenge test, your blood sugar is checked an hour after you drink a sugary liquid. During the 3-hour glucose tolerance test, your blood sugar is checked after your fast overnight and then drink a sugary liquid. The earlier you get diagnosed with diabetes, the sooner you can start treatment. Okay, this is about my information to prevention, diagnosis, treatment, and I will to back to moderator.
Okay, thank you, Nurse Wardah, for explanation of diabetes. Start from understanding causes, signs and symptoms, complication, and prevention of diabetes. The next is question and answer session. We will ask to we will ask two questions about diabetes. The question is evaluate if you understand or not of the health education of diabetes today. If you want to answer, please raise your hand. And the first question is what is diabetes mellitus? Okay, okay,
Diabetes mellitus is when we have a high blood sugar level, nurse.
okay. Good answer for Nabila. And the last question is what causes of diabetes mellitus? Who can answer? Please raise your hand. Okay, please, Amir.
The causes of diabetes mellitus are immune system mistakenly attack and destroy insulin producing beta cell in pancreas and gain factor may play a role.
Okay, good answer for Mr. Amir. Now, I think that's all about health education today. Thank you for Nurse Nabila Vindi and Nurse Wardah for explain the material of diabetes mellitus today, and thank you for you to attend this health education today. And I'm sorry if I make mistake. I hope we can meet in different health education season. Thank you for your attention. The last I say wassalamualaikum warahmatullahi wabarakatuh. Good morning.